So being an ambassador, I guess I really thought that we'd be the ones, doing all of the helping and leading others and mentoring others. And that has been the case to a certain extent, but I feel like the experience has been as helpful for me and as rewarding for me, as it has been anything.
Like, she looked so healthy and she was doing all the things that babies should do. And I'm a person that tends to believe that everything just works out. But everything from that point has been so hopeful. And there was a community that greeted us on the other side. And that's what I want to be part of.
So listening to your stories, when you get in your own sector, you're just thinking about only things you're doing, only things your families are dealing with. And so when you get outside of it and you hear, not only is this group dealing with it, other groups are dealing with it and they're dealing with it in this capacity, or they can also give you other avenues to use. So that's what I've learned from being an ambassador, and it's really been helpful. Be active. Be as active as you can possibly be, because your kids get older. My son's a teenager now. There's so many more people that are affected by newborn screening, good or bad. Like I said, you forget about newborn screening. So you go back into it and you realize oh, this is important. There are a lot of things that aren't even on the list to get screened for.
I would say for me, being an ambassador has just opened up my eyes a ton to how vast newborn screening is and how many different elements there are to it. I think after diagnosis, you kind of get really into your own disease group. And so there were a lot of parts about it that I just didn't understand.
I tell others that, newborn screening is something that they need to be aware of, that new mothers need to understand will happen. I share Elliot's story with anybody I can. I always advocate for parents to be as involved as they can with just asking questions and just knowing that just because your child doesn't have a positive result on a newborn screen doesn't necessarily mean that they don't have a disorder.
I was just talking to another ambassador last night, and I am that other voice in the room. I can give a different perspective. I'm in the room with these ladies and they're giving me so much different perspective on their day-to-day life goes, and I'm giving them perspective on how, a day-to-day life goes as a father. And I think we take those stories and we build upon each other.
Yeah, I think I entered the program thinking, it was going to be a learning experience, but the kind of bonus has been the relationships that we've built. My son had a health crisis earlier this year, and so I texted Susan. I was 1,000 miles away, but I knew she was there and I knew she'd understand. And so just having those relationships built with people that, maybe live across the country from you or wherever has been just, like I said, an added bonus.
And although we're all different and our experiences are different, there's this interwoven thread through each of our stories. And I think that's been something really powerful for me as an ambassador, that I've realized that as much as there are differences, there's a lot that connects us.
Yeah, it's similar like a reunion.
Yeah,
it's like, oh, I remember doing that.
Yeah.
It's like a reunion.